So I'm going to review the paper from several months ago, the significance of initial hemoglobin levels in severe trauma patients without pre-hospital fluid administration. This paper is important because many of us are taught that early hemoglobin levels after hemorrhage are not useful. This is because we bleed whole blood. Therefore, when you go to sample your hemoglobin, it will not reflect the blood loss right away, period. We're taught this is the case because it takes significant time for the free fluid to move from the interstitial space into the vessels, which is what we sample when we measure a hemoglobin level. This study completely calls that assumption into question. We know that blood is a potentially life-saving intervention after major hemorrhage, while the risks associated with blood administration are relatively low, and we have substantial experience with administering blood after hemorrhage. This is a limited resource. Blood shortages are common, and therefore potential methods to conserve this limited resource are needed. This was a single-center study in Japan in which they included patients with an abbreviated injury scale of 3 or greater, so patients that were pretty mangled up. They did not receive pre-hospital intravenous fluids. They had a hemoglobin drawn upon arrival to the emergency department. 250 patients were included. They found no correlation between the time to hospital arrival and the initial hemoglobin levels. The median time from injury to hospital arrival was approximately 45 minutes. However, they did find significant associations between the initial hemoglobin levels and the need for hemostatic interventions, as well as mortality. This study suggests that if the patient arrives with a normal hemoglobin level, we should reconsider how significant their transfusion needs are and consider trending the hemoglobin levels prior to administering blood. I have more to come on this particular topic.